Hi everybody. This is a lecture about HCPCS. HCPCS is something I need you to have exposure to. It's very hard to do on the online arena, and so I'm trying this video to see if it will help, and looking at some websites and some links that I can put in the content for you this week as well. HCPCS is another coding book that we have to access and use as a reference when we're coding on the outpatient side of things. In class, I get old HCPCS books from people in the surrounding communities and in hospitals and clinics. They give me their old ones. It is a book that changes every single year, just like CPT and your ICD-10 books do. However, it'd be one more book for you to buy. So to keep costs down for the students, I think you can get the gist of how to use this and when to use it if we simply use these old ones and show you. I know it's small here, but I have a book right here I'll put in front of the camera. As you can see, it's 2012, but it is ring bound. It says HCPCS Level 2, okay? It is published, as you can see, by Ingenix. When you open this up, it is much like ICD-10, and where you have an index right at the very beginning of the book. You can see the word index there and how to look up codes. It very, very much looks like, to me, ICD-10, okay, and how that works. You can see over on the edge, we have our headings that we can look up. It's alphabetic, so I could look up in here crutches. Okay, anything that comes out of HCPCS is going to be supplies, drugs and biologicals, so any medicines. Remember from CPT coding where we have to have a code for the substance and then a code for the injection, right, or the poke. We have to have what's in that vial and then the poke or the push. What's in that vial, or the drug or biological, is a code that comes out of the HCPCS book. They start with a J. I think we've hit on them a little bit before. There's a great table of drugs and biologicals in this HCPCS coding book that you can reference right away really easily. HCPCS is built into our 3M encoder. However, in the 3M encoder, you can look at the CPT book, right? And you can look at the ICD-10, CM, and PCS book. You can't look at the HCPCS book in 3M, and so that's why we're trying this video here today. What I want to show you and what you should see on your screen here is a website that I went into. And it was a website I just searched, and it's HCPCS codes. It's https:// HCPCS codes. I went on here to HCPCS codes level 2. This is the website that it is. I went right to the code lookup, and it gives you the sections here that we can see on the screen. There are codes that all start with an A. All HCPCS codes start with an alpha. Okay, that's different for CPT. Okay, all codes start with an alpha, so they stick out. We can tell which ones they are. So codes that start with an A say they're transportation services, including ambulance, medical, and surgical supplies. If you do any of that kind of coding or billing, you're going to use HCPCS codes, and they're going to start with an A. Same for B, enteral and parenteral type therapies. If you do any of that kind of coding, you're going to use this HCPCS B area a lot. C codes are temporary codes for use with the outpatient prospective payment system. D codes are dental. E codes are durable medical and equipment. So for example, if I click on here and I search here for crutches. Now before I search, it gives me all these codes. Okay. You can see canes, okay, of all materials, canes, quad or 3-prong. Crutches, forearm, underarm, crutch substitute. Look at all the different types of crutches. One thing I think that I thought when I got out of a class and went to work was, to bill out a set of crutches, it'd be, super easy. And I'm pretty sure my provider did too, because they just wrote plain old crutches on the charge slip. And when I went to actually bill these out, I pulled my HCPCS book okay, to bill out my crutches and find the code. And when I got here, I thought, okay, I need to talk to somebody. If you can see, E0110 is crutches, forearm, includes crutches of various materials, adjustable or fixed, the pair, complete with tips and hand grips. Crutch, forearm, includes crutches of various materials, adjustable or fixed, each with tip and hand grips. So you can see the difference between there. We got a pair and we just got one. Crutches, underarm, wood, adjustable or fixed, pair with pads, tips, and hand grips. This is each, wood. And then we have other than wood, so metal, okay, pair, and other than wood with pad, just one. So looking at all of those, you can see that we really need to know what kind of crutches that we're handing out to our patients. And then I would report this supply code, okay, this HCPCS code, as well as my procedure code from the CPT book that we did today. Maybe it was an open reduction internal fixation, right? And then we had to give crutches. So this is capturing that supply. We have to buy those crutches. We order them and we get charged for them. So we need to turn around and charge our patients so that we can get that money recouped back, so we can pay our bills. So any supplies come from the HCPCS code book. Also, let me go back here. I use the J codes a ton as well. When you look in J codes, of course, it gives us all of them. And this is a pretty good website, but it's just not really representative of how the book looks, I guess. If I go in my book, and it's color-coded all on the right here, kind of like your ICD-10 book always is, and it's alphabetic as well. So when I get to my J's, they kind of have a black heading over here, you can see. Okay, this color is black right here. It tells me that these are J7604 to 7648 and that they are drugs administered other than oral method. It says that all on that black line here where my fingers are. If you look at the codes, you can kind of see some colors here. And at the very bottom of the page, you see a lot of notes. Just like CPT, we have a lot of symbols. They're at the bottom of every single page. I really don't make you memorize them, right? Same for HCPCS. We've got a lot of information at the bottom of these pages. Little shaded blue boxes say, hey, there's special coverage instructions. Red boxes that are shaded in say these are non-covered by Medicare. Good to know, right? The yellow shaded boxes say carrier discretion. So it's up to the carrier. Might be not sure on that one. A check mark says quantity alert. So if I bill this out and that check mark is there, I'm going to have a quantity specified, okay? A circle is a new code. A triangle is a revised code. There's a little tiny A that says there's an age edit. There's a little tiny M that says there's a maternity edit. So if I'm billing for somebody super young or super old, or somebody that is pregnant, I might have some rules I need to follow there. There's female-only codes, male-only codes as well. So when I go to this drugs section, I can look up all these codes. I can get a lot of helpful hints from them. It's really, really nice. But at the back of this HCPCS book, there is also a table of drugs and biologicals, which is really, really sweet. It's Appendix 1. And I can look them up by drug. Okay? So let me see. I'm going to look for an example. I think there's a good example of epoetin. Let's look up in here. Epoetin. Now I'm looking on my table of drugs and chemicals, but it's the same thing as what's on your screen right now. Do you see all these codes? All drugs and biologicals start with the J. Okay, so they're all that substance that we injected. Epoetin alpha for non-end-stage renal disease use, 1,000 units. Epoetin alpha, 1,000 units for end-stage renal disease on dialysis. Epoetin beta, see these were alpha, now these are beta, 1 microgram for end-stage renal disease on dialysis. and beta 1 microgram for non-end-stage renal disease use. So I've got 4 codes here, or 2 of each, epoetin alpha and epoetin beta. I need to make sure. If I don't know for sure because the doctor just put EPO, I'm going to query, right? I need to go back and I need to find out what we're really giving. If I don't want to bother the provider, I did a lot of talking with the nurses. They're the ones that gave it, right? So they know what they gave. If I gave 2,000 units of epoetin alpha and the patient did not have end-stage renal disease, we were giving it for some other reason, and I gave 2,000 units, this is 1,000 units, okay, equals 1 kind of. I would put 2 units in my screen when I'm entering in my codes, okay? When I think about entering codes and putting them into the system, I think about Excel, okay? Microsoft Excel tables, right, with columns and rows. There's a whole column, okay, for units, and you would put 1 unit if you had 1,000 units. If we were given 5,000 units, we would put 5 for 5 units. Does that make sense? Okay, 1,000 unit equals 1, okay, 1 amount or 1 unit or 1 injection. So if we gave a lot more, okay, units are a big deal when you're talking about drugs and biologicals. Depo Medrol is another one. Let me see if I can find this. Let's see. Oh, it's not working for me. Hold on 1 second. Typing in Neupogen and using this for an example is a good one. When I type in Neupogen and then enter, nothing comes up. Okay, nothing at all. That's a medication. I need to code the substance. Why am I not finding it? Neupogen is a brand name. Okay, we know brand names with capital, so I could try that. Still not working. Doesn't bring anything up. With your table of drugs and chemicals in your HCPCS book, you want to make sure that you have a good drug book right beside you. And a lot of them are virtual right now, and that's really cool too. If I go to Google and Google up Neupogen, it tells me, oh, filgrastim. If I go back here and type in filgrastim, the generic name of Neupogen, here I've got a bunch of codes. Look at the differences between this. 300 micrograms, 480 micrograms, excludes bisosimilars or 1 microgram. These are some terms I might have to ask my nurse about, right? This is TBO filgrastim, 5 micrograms, TBO filgrastim, 1 microgram. So if I gave 300 micrograms in the injection, I would use J1440 and then use my code, my 90714, for my nurse push or my administration, okay, of that medication. Same if I was doing 480 micrograms. So Neupogen, it was a good example. You have to look up and find the generic names. Your HCPCS book isn't good with so many brand names. There's just too many out there. And so they use very much so the generic names. So you have to use a drug book to look up your generic from your brand name and then get where you're going to in the book. And the same thing happened with this website as well here. So again, if you go back, we can look at all these titles again just to overcap, make sure that we go through them. And then we'll be done with this video. We've got durable medical equipment. Here's alcohol and drug abuse treatment services. The J codes are, again, the most common that we use. Drugs administered other than orally and chemo drugs. Orthotic, prosthetic type devices. Any casts and boots and crutches and wheelchairs and walkers and anything like that. All supplies and drugs and biologicals and things like that come from this HCPCS book, okay? The HCPCS book, okay, that looks maybe a little bit like this. Again, it's one more reference for you to use when you're coding. We save you money. We don't want you to buy it. We just don't use it enough in class. But it is something I want you to have exposure to. So I hope this video helped. You can go out there and dig around The website here